welcome to the Eyecare Experts. I'm Dr. Bell. I'm here with Dr. Teresa, and we want to welcome you to our broadcast, our second one. Whether you're viewing it or listening to it, we certainly want to welcome you, and we want to make this as interactive as possible. So, we're going to be talking, but certainly any questions you guys have, certainly on comment sections or go to Facebook, certainly subscribe to us. We certainly want to hear from you. And any questions, concerns, or just something that you've experienced, we'd love to hear it and incorporate that in any future shows. But to start today's broadcast, we're going to talk a lot about sports safety, especially because April is Sports Eye Safety Month. But before we get to that, I thought it'd be good for us to give a little bit of background as far as, education-wise, where we went to school, how long we've been doing this, or anything else. So, Jean Teresa, if you want to start and go through some of the background there.
I will. I started practice in Pensacola in 1974. In 75, I opened the first practice in Milton, followed by a practice in Flomaton, Alabama, which has since closed. And then we opened an office downtown at Palafox, across from the Sanger Theater. And then we opened on the west side at the corner of Fairfield and Lillian Highway. And then we opened at 9 Mile Road at the Beulah Crossing in the Publix shopping center. And then we opened in Foley on Mackenzie Street opposite the city park. And those are our 5 locations.
So 5 locations, and we've got a total, of 7 different optometrist providers? Is that right? I think that's right.
Well, the total is 8.
Total is 8. Okay.
But that's including us.
Okay. And give them a little bit as far as you talked about opening up practices, but where did you go undergrad and optometry school, and a little bit about that?
Yeah, I was in the so I went to college in Baltimore and got a Bachelor of Arts and Science at Johns Hopkins, and then I went to the University of Alabama Medical Center, and I was in the first class out of UAB, and then after that, I took graduate courses at UWF and at the University of Pennsylvania Wharton School of Business. I have 2 certificates from there, and that's about the limit on the education.
Well, one thing I'd like the viewers to know is the one thing I admire about you, or there's a lot of things I admire about you, but one thing in particular is you're always going to every CE, every lecture that's offered on optometry, ophthalmology, as far as new technology, as far as advances in eye care. I believe you go to every one of those. So if there's something new that we didn't learn or something that came out since you graduated, a lot of doctors would just say, hey, I don't need to know that. But you're always learning the new stuff and trying to stay up to speed and trying to incorporate that into practice the best that you can. And I've looked from a side on that, and I've always admired that.
Well, I appreciate that. I just came back from New York at what's called the Vision Expo, or the World Optics Convention. And there the big emphasis this year was on AI, or artificial intelligence. So medicine in general was one of the last industries to computerize, and I was guilty of that also. But I missed that boat, but I'm not going to miss this one. And I see medicine shying away from it, and we plan to incorporate it within the next 3 to 6 months and fully participate in that aspect of evolving healthcare.
Yeah, I see AI being a big tool as far as being utilized in a lot of different areas. I know we talked about, even currently, I think there's some practitioners or providers that are using AI to dictate charts and things like that. I believe that to be true. But there's so many, I think, different ways and unique ways that could be incorporated into a day-to-day practice.
It's funny you say that, because from the patient side, I've 2 surgeons use our Meta glasses, and these are replacing their phones. So while they're doing their surgery, they tap the side of their glasses and can dictate the notes on the surgery and save up to 2 hours a day by doing that. And they're crazy about it.
Man, that's awesome. Well, myself, I went to University of Alabama as far as undergrad, and then I went to optometry school at Southern College of Optometry in Memphis, Tennessee. Graduated there in 2005. Floated around, went to practice outside Washington, D.C. for a little bit, and then in Jacksonville, Florida. But certainly I've been here in the Pensacola and the Panhandle area for a good while. So luckily enough to be a partner with you and to see us, take care of patients' needs, but to see us grow, expansion as far as locations, and there's definitely a need, certainly in this area, for both vision and medical in the optometric field.
That's one of our characteristics, is that we handle both aspects of that, and most just concentrate on one or the other.
Yeah, we certainly want to hit you, get you with glasses and contact lenses, but anything medical, glaucoma, diabetes. I had a day today that was on Plaquenil. There's a lot of different drugs nowadays we monitor for toxicity, but certainly any of those medical needs, give us a call. We'd love to see you. Go to our website, teresaoptical.com. All different offices have their own numbers, so call. And if you don't know which office is closest to you, certainly give us a call, and we'll figure out where you're located and try to get you to that location. But back to the safety, as far as the Sports Eye Safety Month in April, what do you think as far as ways generally to tell parents or anyone, ways to prevent for their kid, or, if they're playing a certain sport, what are things that they can do to kind of help avoid an eye injury or something like that?
Well, estimated 100,000 people are hurt by sports-related eye injuries, and 13,000 of these injuries result in permanent vision loss. The thing about it is most of those are preventable, and that's a good thing.
Yeah.
So, there's different types of eye injuries. You can scrape the front of the eye, and that's called an abrasion. You can hit it so hard that the colored part of the eye becomes inflamed. You can hit it so hard that you break blood vessels inside and outside the eye, and that has a fancy term to it called hyphema, and that needs to be treated. There's traumatic cataract, which means the blow again was so hard that the delicate chemicals inside the lens of the eye, which is located behind the colored part, gets shook up enough that the chemicals change their elements, change position such that they're no longer transparent. And when that happens, then you can't see, and that's a surgical problem that has to be addressed. And of course, the back of the eye can be impacted by the trauma to that eye, and you can have things like a detached retina. And then the whole socket itself can be fractured too, and that's also fixable. Usually, interesting enough, in the old days it was metal, but now they use mylar, which is a substance they make sailboat sails out of, and it stays for years and years.
Well, I think the general, if you have an eye injury, whether it just be the slightest, hey, it's red, it's hurting, I'm light sensitive, or pain, you need to, certainly need to be seen, because some things that seem to be mild, you may not know you have a detachment or, something serious unless you're seen. So if it's hurting, anything like that, I'd much rather you come in and say, hey, everything's okay, and then not come in and it be something that gets worse over time, or take a chance of losing that vision permanently.
I agree. Just because you don't have a symptom doesn't mean that things are kosher in there, and it's good to get it checked out. And remember, you only get one set of eyes, so it has prime importance.
And we have slots available for emergencies. So even though we may be booked out a few weeks as far as full exams, give us a call. If there's eye pain, you're seeing flashes, hey, I got hit, with a baseball and this is hurting or that's hurting, or it's red or there's bleeding or anything like that, certainly give us a call, and we will try our best to get you in that same day, if not certainly within a day or two, depending on the severity of the symptoms. So, certainly don't brush it off. Certainly give us a call. Let's go back a little bit. As far as glasses, and we talk about NC and stuff, standards and stuff like that. I know we do a lot of sports goggles, especially out of our Palafox office, but talk a little bit about sports goggles and what do you tell parents and things like that, as far as if they say, hey, my kid's got this regular pair of glasses, is this good enough for sports, or should I get something else, with regard to both the lenses and the frames?
Well, the chances are that if he's playing an active sport, soccer, football, baseball, you name it, the chances that a projectile is going to hit the face are relatively high.
Yeah.
So those lenses, usually what happens is they get by with the one pair of glasses, and that gets hit and broken, and then it's relatively expensive to get all that put back together again. a separate pair of safety glasses. These lenses are made, you can twist them, you can tie a knot in them. They're very tough, okay? And the lenses are made out of a substance called polycarbonate. And there's different thicknesses on that, and we build them to ANSI standards. And I might mention we build those in our own lab as opposed to send it somewhere. And that way we have strict control, and we can customize it as we want to.
And so those lenses you're mentioning, so if it does get hit with a force, they're shatterproof. So it doesn't. That's what we're looking for. Is that they don't, like a regular lens or one that's not plastic or polycarb or a certain ANSI standards would shatter if something hits it. And so the last thing we want is to shatter in your face or in your eye.
That's 100% correct. The only thing that will go through a polycarbonate lens of safety thickness is a nail if you drive it through with a hammer.
And so depending on the sport, certainly come in and let us know. I always want parents or, if we're coming in for an exam, let us know, what sport you're looking at. I get the question all the time, my son plays football. Do you think he can wear these underneath his football helmet? Does he need sports goggles? Would contact lenses be an option for him? So certainly those are questions that we want to address and on a case-by-case basis, try to figure out what might work best for that individual.
Well, for those athletes, they'll gain tremendous peripheral vision for football players and basketball also. But that affords very little protection of the eye. So the idea of having safety glasses with no prescription in it that you wear over your contacts, you win both sides of the game that way. Gotcha. And it's a very good idea to do that.
Yeah, I guess I was thinking maybe sports that you already have a helmet or protection, maybe with contacts, but you're right. If you don't, even with contacts, you still could get hit, certainly in the face. So we got a few questions, so I want to just kind of jump to some of the questions that we get. And certainly, like I mentioned at the beginning, hit us with any questions or concerns. We always want to hear from patients and the listeners and viewers out there. The first question is it safe for my child to wear contact lenses when they are participating in contact sports like football? What do you suggest as protective eyewear for them? So we talked about that a little bit already, but is there anything we didn't say that with contact lenses, I know that personally I've worn contacts through my younger years and certainly playing football, and I didn't have an issue, but I would always say if you do that, always carry your case, your contact lens case in solution, because there's many practices or times where I got dirt or there was so much sweat in the eye, I had to take the contact lens out and wash it and clean it and then wash my hands or whatever and then put it back in, or, one of the assistants kind of help me or do that for me. So make sure you have something in case there's you need to take it out, or if there's an issue, you have the something available for that contact lens.
Well, that's important because the truth is, for most, it's almost metaphysical. The most problems that you run across will escalate with the eye. They do not go away. So you can bring it to different levels. And so before it gets out of hand, so to speak, then you want alternative ways to have that lens out and take care of it before it escalates.
So I think either one, contact lens, this is specifically regard to someone who plays football, so contact lenses, and I do think there's some sports goggles out there that probably would fit underneath the helmet. I guess it depends on how big the head is or, what age we're talking here, but I've definitely seen quite a bit of football players that do wear a sports goggle, and they're making those frames, I think, sometimes a little bit more petite, so they will fit underneaath the helmet or something like that.
Yeah, they're goggle-like is what they are.
Yeah. Kind of like a swim goggle sort of thing, but it'll protect the eyes underneath there. So moving to our second question, I recently began playing pickleball, which is a very popular sport, seems like nowadays, pickleball. Do you recommend vision protection? And if so, what is the most ideal option that incorporates my prescription lenses related to vision protection necessary when playing pickleball. So this person is asking if they're playing pickleball, is there vision protection available, and is there something available that they can wear if they have a prescription in that, I guess is what the question is.
There are. There's a company called Liberty Optical, which is a manufacturer here in the States that made specific on those. Their hinges on their frames, the side part, can bend totally around 270 degrees to the front and then all the way around the back, whereas normal ones are simply one quadrant or 90 degrees. And so they're there. They also make different bevels. A bevel is the edge of a lens that fits into a frame. you can get a V bevel, or you can get one with two V's in it, kind of like shingles on a roof.
Mm-hmm.
And with those double V's hanging on into the groove of the frame, the odds of that lens coming out are very small.
And they can get that in any prescription, pretty much, that they nearsighted, farsighted, or
Most normal prescriptions,
Okay.
yes.
Gotcha. Well, we're let's see if we didn't cover any. I think we went through all the different conditions that could happen. But the main thing is do the best you can. I know, expanding from sports safety, I have a lot of patients that, come and see me because they were grinding metal in the shop or, in the backyard that were, weed eating or cutting. So it's not just sports related. I mean, anything that you're doing where, something dirt, grind, rocks could be shot up, certainly in the face, or wear protection. I mean, it's the simplest tasks. Sometimes I know when I weed eat my yard or I go out and edge it or do any of that stuff, I'm always wearing protection because you never know when something could just get shot out right and hit you in the eye. So certainly, grinding metal's a big one. When I was practicing in Jacksonville, Florida, our office was right up the street from Tulsa Welding School, and I think once a week or twice a week I had someone come in with metal in the eye. And I can tell you, it's fun for me to take it out, but it's not fun for the patient. Metal in the eye and the feeling of that cornea and the light sensitivity. It's not a fun deal. It hurts
Pain
the
is
patient.
intense,
Yes,
yes.
it's very, very intense. And sometimes, even though we get it out and we get you back, depending on the severity of how the velocity of it being shot, it could leave a permanent scar in the eye too. And, if it's on the periphery, maybe it's not too concerning, but if you get one dead central and you get that scar and it's in your line of sight, that could be with you from now on.
So a scar by definition is opaque, that is, light doesn't pass through it. So the light coming at you bounces off that, and that creates a starburst effect on lights, on headlights on other cars, all kinds of stuff that'll drive you nuts.
Yeah. So if you get something in there, and your cornea and metal do not go along. So, and even fiberglass. So if your cornea, you're light sensitive, your eye's red, it's hurting you, certainly come in, because it's a lot easier for us to get metal or something out of the eye when it first happens than it, staying there for a couple of weeks, which I've had patients that happen, and then the epithelium of the cornea kind of grow over it, and then you got to go in there and kind of dig that out. So it's a little bit harder to kind of remove it, where if we'd have caught it early on, it would have been a little bit easier for the
It's
patient.
like digging a post hole. And then you make a big hole, which is going to take much longer to heal. If it gets infected on that, then you're out to Baptist Hospital or wherever, and you're in a major production.
And then it could leave, especially if it's metal, it could leave a little rust ring around it. And as that metal stays in there the longer, it seems like the more rust kind of spreads through the cornea. And then we have to use an algae brush to go around and kind of remove that rust as well. But we're getting close to the end of the sports safety podcast. So I want to thank everybody for listening, watching, and encouraging everybody to kind of comment. Certainly subscribe to us. If there's any topic, you'd love for us to talk about, any questions, certainly feel free to do that. We'd love to hear from you. And thank you again for listening to us.
Yeah, stay tuned for our next podcast also, when we discuss women's eye health and safety.
Thank you.